All right, good morning. Does everyone enjoy like the massive amount of rain that we had?
No.
No?
Hate it.
Oh, you hated it? Oh, I love the rain so much, right? I love it, and I was so grateful that we got it, except that we lost like 50 shingles when we had that crazy rain. And so we had leaks everywhere, so we're like, yay, it's raining now, I want it to stop, like, all night, it was like, yay, no, yeah. Oh, anyway, and it's freezing, but I love it, it's kind of nice. And forgive me, my voice is so scratched up, like the fire last week and the wind, and then it got cold. So I don't think I'm getting sick, but my throat has definitely been like bothering me. So forgive me if I'm like all scratchy or coffee or whatever today. But we'll jump back into where we were. Oh, I'm holding it in my hand. I'm going to pass this around. I'm no longer going to take attendance, right? Which is nice. We get that in a few minutes back. So just do me a favor, and every day you can initial or you can write your name on each day. And if something's wrong or you prefer a different name, fix it on here and I'll update it for next week. So if you want to go by something else, just change it on here. It's not worth any points, but it does help me keep track of who's here, which sometimes can be helpful. And if your name is not on there, then you're not enrolled in the class. So make sure you touch base with me afterward because I just printed it. So that's everybody who's enrolled. So just make sure you sign it. It'll kind of make its way around the room, and then you can either hold on to it over here or bring it back up to me. And I'll do that every day instead of taking attendance from here on out. Okay? All right. So last time we didn't get too far, right? But we talked a little bit, or well, that was kind of back, but we talked about what is abnormality, right? And then looking at some, we talked about trepanations and exorcisms and some of these shameful things that we did. We looked at humors, the 4 different fluids that Hippocrates thought could flow through the body. Again, no scientific basis for it, but kind of a different shift. And then I believe I have that we left off here. Keep pushing buttons. So again, like what we see a lot of in psychology, and I think throughout history, is we see a lot of like you go one way and then you go the other. There's kind of this like rotating back and forth. And so what we saw is as we move forward again, we went back to the idea of like demons and demonology. So if we go forward just a little bit more, we thought that again, any kind of like disorder or dysfunction was the result now specifically of Satan. Forget demons, now we go straight to Satan, right? It's Satan's influence. And so we go back to the idea of trying to coax demons out of the body. The church was a really like big influence, a lot of power at this time in Europe. So it really influenced a lot of our thinking about mental illness and so on. We had these really bizarre things come out of this time. It was a time of like the witch hunts, as we started to talk about a little bit last time. And so we got these like impossible tests where if we would put, it was typically women, put women on the edge of like a stick, tie them to it like on a chair, and dunk them in the water. Okay, now if they survived, they were a witch, and then we'd kill them. If they died, oops, right, they weren't a witch, right? Like it was an unwinnable situation. But oftentimes anyone who acted strangely, bizarrely, right, we viewed it as the work of the devil. And so we had to coax the devil out of the body again through like exorcisms or bizarre like tests and trials that came out of that time. If we go forward a little bit more, the Renaissance means rebirth. This was a much more positive time. And we had this guy, his name was Dr. Johann Weyer, who came up with a really amazing idea. He said that I'm going to take people who are struggling with mental illness, who are having a hard time with life, and I'm going to give them a place of safety. Asylum means safety. Now, when you think of an asylum, and I want you to like in your mind, picture or think of an asylum. What do you picture? Do you picture like a nice, safe, comfortable environment? What comes to mind when you like picture an asylum? Yeah.
I kind of picture the same building as prisons, but maybe more holes in the wall.
Okay.
And like those awful blue colored patient things they give you in the hospital.
Okay, like
Like
scrub kind of
gowns, yeah.
gowns and,
And I kind of imagine it as a very like basic things you need and that's it. Like for instance, you get food, water. I feel like before they work with like treating the patients as they should have been treated.
yeah,
So that's what I imagine. I kind of imagine like a very low living level.
sure, yeah, same, right? How about for you? Season
Great.
2, right?
Yeah, same, right? Like, season 2 of American Horror Story, great portrayal, or I don't know if we'll say great, but portrayal of it, right? Anyone else, what images, like, what else do you see in your head when you think of an asylum? Yeah,
Sterile.
sterile, okay,
Like smelling and looking very sterile.
Okay, all right, yeah,
Patients screaming down the hall.
screaming, right?
yeah, I picture like dark and screaming, I don't picture good things, yeah. Yeah, padded rooms, straight jackets, yeah. Right, yeah, straight jacket, right, where you're like strapped to yourself, can't move, do anything. Anyone else? I thought there was another. I'm gonna skip you. Yeah,
Herpes socks.
What was that?
Herpes socks.
Grippy socks, right? That might not be the worst part, right? Okay, all right, like the things that I might imagine, right? Like, so white, sterile, those things actually came way later. Asylums at this time were horrible, absolutely terrifyingly horrible. They were like these filthy prisons, basically, for people who had mental illness. They would lock people in these cribs where you couldn't move. They'd spin people in circles till they passed out. They did all sorts of really bizarre and awful treatments because we had no idea how to cure people or how to treat people. But the idea behind this was really like a good one. Johann Weyer had this thought again that like, I'll put people out in the country in like a big house where they can relax and be away from the world. And they literally became like prisons for people with mental illness, where people often died in their own filth. They rotted away. Like there was just no sanitary conditions, no good treatment whatsoever. But it was motivated by the purest of intentions. Right? And the most infamous, so famous in a bad way, of all these different asylums was a place called Bethlehem Hospital in London. Now, Bethlehem Hospital was this massive like place. It became known as like a palace for lunatics, right? And we get the term lunatic coming for the first time, someone who is crazy, right? And often related to the moon, like Luna and the moon. But this place, Bethlehem, became known over time. It went from Bethlehem to Bethlehem to Bedlam. And Bedlam means chaos or madness. So this place became known as Bedlam instead of Bethlehem. It just kind of evolved over time. I have like a tiny little excerpt from a documentary that shows you a little bit of it. So I'm going to play that for you. But this is probably the most infamous of these massive asylums that developed around this time. And most of them are no longer there or have been converted to other, not treated in any kind of good ways, but it was meant to be a progression away from some of the like more cruel, harsh things that we were doing in the past. Now, they kind of failed in that, right? Again, asylums don't tend to have a good connotation when we think of them, but it was, again, a little bit of a shift. And then we made another shift to kind of build on the idea of asylums as we got into like the early 1800s. A new idea came, and this was revolutionary and controversial. It was called moral treatment. And the idea here was, what if we treat people who have mental illness as people, right? There's this weird idea that came about that we'll treat them as people, we'll give them respect, we'll give them good conditions. Let's not do asylums, let's do state hospitals, right? It was like a new idea, and it was going to be funded by the state. It would have more money, better conditions, and it would be driven by this new wave of what we call moral treatment. So treating people like kindly, giving them purpose, treating them with respect, treating them like people, right? Very new, controversial idea. So we opened all these huge state hospitals to try and do this, and it was a little better, but they didn't have money. They had shortages of staffing, and they had no idea how to treat or cure people. So they ran into a lot of the same issues, but again, good intentions and a little bit better, like trying to get closer to where we are today. So these state hospitals were an improvement, but by no means like solving the issue of what to do and how to treat all these people who have mental illness. out of this time, a couple of interesting pieces of artwork came out of this time. Here's one of them. This doctor, Dr. Philippe Pinel, was one of the people kind of instrumental in this idea of moral treatment. So this is the Paris Asylum for Insane Women is what they're portraying, removing the chains from the prisoners, treating them as patients instead of prisoners for the first time, talking to people instead of bleeding them or starving them or using physical punishment. So again, just kind of transitioning toward a more like ethical and humane form of treatment. So here's one piece of art. Another one that's kind of cool. I think this one's even more interesting. This one's called Dance in a Madhouse or the Lunatic Ball. And you can see that they're portraying them as being mentally ill by having like really disfigured faces. But one of the things of moral treatment was let's let all of these patients have big dances or parties or kind of galas, and they could dance and celebrate and have food and all these kind of meaningful things as a way to give them a purpose and a sense of normalcy. And so you see this picture portraying that by kind of again giving them all disfigured faces to portray that they're mentally ill. I think it'd be so fun to be a fly on the wall at that party, right? Like just to watch. It'd be interesting, but it was this new idea, again, trying to give people purpose and meaning and social interactions like people, right? Instead of treating them very cruelly. Lots of movies featuring psychiatric hospitals and asylums, movies and TV shows, right? Like the one you mentioned as well. So lots of different ones kind of varying, right? Some older and some a little bit newer. Really, it's just a kind of a couple of them to put up here. The interesting thing about all these state hospitals is they were popular all the way up until like the 1980s, early 90s. And then we hit another wave of like, maybe we shouldn't put people into these hospitals. Maybe this isn't the best way to go. And so a lot of them shut down or were abandoned almost overnight. Right. So a lot of these massive places just got just completely abandoned, almost like I said, overnight, or they got converted to other things like Cal State Channel Islands or whatnot. My first job as, well, I say job, but I didn't get paid. My first like psychology position, I volunteered at a psychiatric hospital in San Diego. It's now a YMCA, which I just think is hilarious, right? Now you can work out in the rooms where they did therapy, but all these places got converted. And I found this kind of cool montage of abandoned psychiatric hospitals throughout the country. I thought it was really kind of interesting, a little like eerie. Just you can see the scope of these places and kind of the feel of what they were like. And these are places that were abandoned in the 80s, and they have that kind of like 50s, 60s, 70s feel to them. So I'll play this for you. Really cool too. When I was in college, everything required to run these massive buildings. And so, as I said, a lot of them were abandoned or shut down. I have to admit that through that whole thing, I was thinking about when I did that Buddhist monastery, they had the best rolls I've ever had in my life, right? And I was thinking about those rolls. They were like this big, and they believe very firmly that you only eat what you take. I took two of them. I was like, I can eat two rolls, no problem. I struggled. They were dense little rolls. I was thinking about that through that. But so many of these different psychiatric hospitals, I don't know, any like thoughts or comments about any of them or about the clip or anything so far before I keep going? Yeah. Yeah.
That one flew over. Yes.
Yeah.
Watched it in my 3 days psych class in school,
Mhm.
and what was really controversial, what a topic it brought up was on lobotomy.
Yeah.
That was, I don't know if it's still legal in Laos, I'm not so sure, I'm pretty sure it's like gone.
Yeah.
The last record was like it's but
It's been a long time. Yeah.
years,
Mhm.
and that was a big topic that was discussed.
Mm-hmm. Very like classic psych
It is very
film.
classic, I feel like it should be in every psych class.
Mhm. I think I have a clip from it in the next chapter, right? Because it's a very like old but classic film. And then some of the newer ones up here, really good too, with different portrayals at different eras and different times. So lots of shows and movies featuring these. Yeah.
Some of the rooms are so, it's so like squished together.
Now you get these massive places, but not for each individual person, right? Very cramped quarters and again, like they failed, right? It was a good idea. The intentions behind them are good, but they couldn't survive with the funding that they had and the resources that they had and so on. And so when we get to closer to now, we're in the last like 20 years. These are things that have kind of been a big focus of the last like 20-ish years or so. And things that are really dominant now. Medication is a big one. Right? And we'll talk about all the medications as we go through the different disorders, but psychotropic medications are very commonly used to treat mental illness. It has become the norm. They are very frequently prescribed. There's a drug for everything and a side effect for every drug, and then another drug to counter that side effect. There's so many different medications. We'll talk about those all throughout the semester. Deinstitutionalization also became really popular, and that's not putting people in these institutions, right? So rather than locking people away, doing more like one-on-one private therapy, outpatient therapy. The idea of putting people in a massive mental hospital is no longer really like common, right? We learned a lot of pitfalls from them, and we now tend to do more like private therapy. A lot of the psychiatric hospitals that we do have are more like a ward within a traditional hospital. It's our smaller places now than the big ones that they used to be. Private therapy is another one that's really common, people going one-on-one. Right. And a lot of therapy went virtual, especially during COVID. But virtual therapy is still really like frequently used and popular. Cyber therapy is sometimes called. But going to a therapist and paying for counseling services is a very common and frequently used like method now. And then focusing on prevention. How can we identify risk factors and hopefully stop some of this stuff before it progresses to a full-blown like mental illness? So we've learned a lot, and we can use that to help identify risk factors, focus on prevention, treat people in more like one-on-one kind of situations, medication if we need to. These are some of the things that are really common now, as opposed to like exorcisms and trephinations and some of the things that we used in the past. And we still don't know how to cure a lot of mental illnesses, but we have better methods of treating them, thankfully. So before I talk about I'm going to skip that one. Before I talk about some of the professions, I want you to find a couple of people around you and write it down, but you're not turning it in. So find a few people, maybe like 2, 3, 4 people, whatever is easy. And I want you to come up with a list of stereotypes related to therapy or therapists. So when I ask you to think of like therapy, the process of therapy, or maybe even a therapist, what do you picture? Like, what are the stereotypes that come into your head? Like the first thing that I think of, just to give you one, is of course they're going to say, how does that mean? It's like the most stereotypical thing. There's a follow-up to that, by the way, which is tell me more about it. So this is like stereotypical phrases. So it could be things that they say, things that they do, what they look like, what their office looks like, what's in it, anything related to therapy or therapists, and write it down so you can remember to share. But find a few people, like 2, 3, 4 people. Write down as many stereotypes as you can, and then we'll come back together in a few minutes.
Yeah, the one like It's like nowadays, because they want it, so when you say it's happening, you think oh yeah, especially the large unfortunate nowadays.
Yeah.
I just babysit somebody and outside. And this kid like 6. Not everything is like I don't know. I would know that there's longer than a little about it. I don't know how, but I don't know.
No, it's not.
It's interesting. Yeah, I was gonna say, active listening, it's a real thing.
Yeah, they're writing down.
Oh, they're
Like they're saying something like writing.
they can't really give their opinion. Oh, it's like all words. It's like,
Yeah, exactly.
it's like, Page 26, but I page like share.
I'd say. Like so honest, like. Oh, always. One day. One day. She says that. If you really need to go there, it's like, oh, let's go on to the way. That's so great. I just see it there, I just kind of just like. You know what, it's like, no, right? This is. Yeah, no, I. I'll be yeah. Now it is like people say like will be not as effective because we didn't help her. Yeah, that's one of the biggest things. Besides, like there's nothing. I don't know. Yeah. Or it's like my dad.
One more thing, and we'll talk together, like, one more thing.
They're not too bad degree. Oh, no. I know. When I was like, everyone is like, oh, they're awesome. Awesome. She's so chaotic.
Mine's like a older white lady with glasses.
You're like, you're my confidence, okay? No, actually, I'd be too. I'd be like, I'm so. They have their baby. I'm like, not loving. Right there, this dog is not loving. I call this loving animal. That was something I noticed about her.
All right, let's together. I want to hear what you came up with. So I have my stereotypes in my mind. What are some of the ones that came up for you? Anyone want to share one that's on your list? Yeah.
Like a woman.
Yeah.
Realistically.
And more specifically, right, I think of like an older woman with has glasses. Like, I don't know, that's like really common, right? Older, typically female, often has glasses. Yeah.
The therapist and their legs crossed taking notes.
Yeah, of course, right? Always taking notes, legs crossed. Yeah. Sure. Right, like these blossoms and things like that. What do you see when you look at this? Of course, of course. What else? What else might you? Yeah, Freud started the couch, right? I'll show you the couch that started it all, but it was actually really uncomfortable. Laying down, right, talking What else do you picture? Anything else? Things they might say, things in the room, things, anything else? Yeah?
A big box of tissues.
Yeah. There's always tissues in a therapy office, right? Lots of them. Yeah.
I'm just like some stress choices with some like mindfulness books, is like the movie meter on the wall, and stuff like that.
For sure. I took my daughter, so I go to therapy, I've gone to therapy like every week for years, right? And I have no problem admitting that. I think therapy is a great thing. It's like somebody who's unbiased, who just listens to you. And so like I've had this stereotype of therapist, and then I took my daughter to therapy last week for the first time. She's dealing with like some social anxiety. And we walk in the room and I felt like it was like they took the stereotype of therapy and just put it in the room. It's like there were like little fidget pop toys everywhere. There was a little like sand garden for her to break if she wanted to. Right? There was the long couch. There were pictures on the wall. Like I wanted to look at this therapist and be like, did you like study the stereotypes? You put them all in here. It felt like it. And she was like a 60-year-old woman with glasses with her legs crossed, taking notes, right? Nailed it. She nailed every stereotype I could think of. Yeah. Yeah.
So it's like so funny. It's like a key we were given at the start is like a box for windows and blinds.
Okay.
And fidget toys and stuff.
Yeah.
Just to like get acquainted with them, but like that's like all they like fixate on.
For sure.
Yeah.
There's always little fidget toys. It's like the big thing now. I always think of like a bobblehead where they're like, tell me more about that. Right. How does it make you feel? And there's all these phrases. Anything else that you picture? Or like things they might say? Do anything else?
I don't
Yeah.
know why I specifically imagine cats.
What was that?
I imagine cats. Like,
Cats.
because I feel like cats are very calming animals. Like
Yeah.
they're kind of selfish, kind of mean. I don't love them, but sorry to all cat lovers. I'm not trying to hit on you. I just don't love cats. But they're very calming animals. Like
Sure.
like dogs on their hand are very like they love to be happy, like jump around. But cats are just quiet. So when someone's crying, you don't want a fidgeting animal. You want an animal who's going to be sitting next to you
Mhm.
and just still. So
Okay.
it kind of brings calmness. I feel like I don't know. That's what I'm.
I mean, therapy would be so much more fun with cats, in my opinion. That'd be amazing, right? I'd be like, I want to go every day, but I have 5 cats at home, so right. I always picture something my therapist always says, and it's so stereotypical and drives me nuts. At the end of every session, she always says, "Don't forget to practice." Just like that, like it's a whisper. Don't forget self-care. And I'm like, every time she says it, it feels so dismissive. Like, don't forget self-care. Don't forget self-care. And so I changed it to cake. I was like, I'll practice self-cake. And like that's like our joke. Don't forget to practice self-cake. I can do that. I do that really well. So self-cake.
Credentials somewhere.
Yeah, it's right. There's degrees on the wall. Right? They gotta put those up because they're in debt, right? They gotta- For sure. Anything else? There's another hand over here. I see them. I dream them sometimes. Yeah. Overly nice. Okay, right? Yeah, like very like careful, right? Everything's very like careful. Anything else you could think of before we move on? Yeah. What was the scented candles? Nice. Okay. Candles. I always like candles, rock gardens, water fountains, something like peaceful zen like in there. Yeah.
The rocks that are supposed to give you, like each rock needs something separate. The Zen rocks you can buy.
Okay.
Like one rock is for happiness, one rock is for serenity, one rock
Mhm.
is for, I don't know what the grade now is, but there's like rocks you can buy if you're into all that kind of stuff.
Okay. Right. Therapy rocks. Yeah.
Answering a question with another question.
Yeah, okay, right. So you give them something or ask them a question. Let me rephrase that and ask it back to you. I like that too. Right. I always think of the term shrink, like for a therapist. Interesting, as a side note, shrink references the idea that ancient tribes would shrink the heads of their enemies. That's where the term shrink comes from. So again, not the best view of a therapist, maybe. Picturing them as shrinking your head like you're their enemy. But a lot of stereotypes, a lot of them are true too, right? Like if you go to therapy, they're often true. Is that a?
Yeah.
Yeah.
Money, I think, for a long time, it was kind of stereotyped as not affordable for everyone, only for the wealthy, and they were charging like these crazy amounts per hour. And
They can be really expensive, right? So if it's not covered by an insurance, it can cost an incredible amount of money to go to a 50-minute therapy.
exactly, and I was even saying in our group that, and a lot of people aren't aware of this, but, and this is recently that, for a long time, it wasn't covered in insurance and it wasn't considered medical at all. And I know this personally because I worked for a health insurance company for 14 years. I worked for Blue Cross of California. When I had stepped into this position, it was not considered. It was considered BHA. It was its own thing. It was covered at 50%. That was it. And, you know, certain diagnosis codes fell into this category. And if it wasn't one of those, then it wasn't covered at all. So, I mean, that would, and I'm talking only maybe 20 years ago.
Right.
So,
Yeah.
I mean, it's even made some leaps and bounds even within a short period of time.
Oh, for
Being
sure.
now considered, you know, medical and now maybe being covered through an HMO or through, you know, like like a PPO
Sure.
and being at 80/20 or having a copay. But for years, it really wasn't even accessible for a lot of people.
Yeah, just ridiculously expensive for sure. And a little bit of a shift too in the mentality of, I think we see more the utility now of helping people with their mental health and how that also translates to their physical health. Versus in the past, it was more like they're separate entities. And so you don't need it because it's not a physical thing that's going to really hurt you. We've learned that it actually really can. Yeah. Anything else? Any other thoughts before we move on? Stereotypes of therapy. And again, if you've gone to therapy, you know, a lot of those are probably true. That's where they come from, right? But anyone in here thinking of going into a career as a counselor or something up here, anything related to psychology? Any ideas as to what? Do anyone have what you want to do? Yeah.
Specifically social work,
Okay.
CPS at like administration.
Okay. Social work. Yeah.
I want to go into psychiatry and private practice. Good option.
Great. Anyone else? I won't hold you to it. You can change. Yeah. Okay. Really interesting. Is that interesting?
Yeah, I would say more like county work, working with like Ventura County behavioral health and like with that type of end of it where you're getting more with how they're gonna approach certain things within the community and
Okay.
how they're gonna provide more care for it, you know, and make it more available, that type of more like within the law and that type of thing, but yeah.
Nice. And there's so many other things that aren't up here too, like forensic psychology and obviously teaching. And there's a lot of other like professions within this career. But let's look at some of the ones that are kind of leading ones for abnormal psychology, right? And again, these are some of the big ones, but there's a lot more. There's an interesting distinction between clinical counseling and psychiatry. And so I want to talk about that a little bit. I put a little chart up here. They're different things, but we tend to refer to them all as like a therapist. Right, but they're actually very different individuals with different training, different focuses, different salaries, right? So I think sometimes it's kind of helpful to know this, but we often refer to them all as therapists or counselors, even though that's not always accurate. So a counseling psychologist has a master's degree. And typically a master's degree takes you about 2 to 3 years after you get your bachelor's. Okay, so a master's degree in counseling psychology in the state of California will train you to be a marriage and family therapist or an MFT. This is what I have my degree in. I have a master's in counseling psychology. It was training to be a marriage and family therapist. Took me 2 years, but 2 to 3 years is pretty common. A clinical psychologist has a PhD, which can take 5 to 7 years after your bachelor's degree. Okay, so they have more education, they have a doctorate, right? They have a PhD level education. So a little bit more training takes a little bit longer. A psychiatrist has an MD, a medical degree, right? So they are a doctor that specializes in prescribing medication. And this typically can take like 7+ years. And these often don't include the internships and hours that you need to do to get the license. So that's just the degree in education. They all have a slightly different focus as well. So people who are counseling psychologists deal with kind of everyday problems. So more like typical stuff, anxiety, depression, right? Stress, relationships. They're dealing with kind of more, I won't say lighter things, but more like everyday typical things. Versus clinical psychologists tend to deal more with more like intense disorders. So bipolar disorder, personality disorder, schizophrenia, right? And in the work that they do, it tends to actually be very similar. But because this person has more education and training, they tend to deal with more severe populations. So if somebody comes to a counseling psychologist who doesn't have the training to help them, they might refer them to a clinical psychologist with more expertise. Psychiatry has a little bit different focus. Anyone know what's the focus of a psychiatrist? Yeah. Yep, medication, right? A prescription of medication. So when you go to a psychiatrist, they don't tend to do therapy per se. They'll talk to you and check in with you, but it's usually related to medication. They're going to prescribe you something. They're going to ask you about your symptoms, your side effects. It's usually a very short appointment. It tends to be about 20 minutes, sometimes 25 if you're lucky, right? And it's very, very based around medication. The other two, a therapy hour is 50 minutes. Not sure who came up with that. 50 minutes long, that's a typical therapy hour. Right? And oftentimes what they would do in these appointments is kind of just talk to you, work on techniques, work on strategies, kind of whatever it is that you want to go through and cover. So much, much shorter, they tend to see a lot more people. These are more like 50 minutes. In terms of salary, so this is an average in California as of 2019. So this is about 5-6 years old. But in California in 2019, average counseling psychologist made $95,000 a year. So $95,000 or so a year. Average clinical psychologist was 110. So they make more money, not by a ton, but they make more money. And then psychiatry, if you're ready for what career you'd like to shift to, they make $250,000 on average. Like I know what I want to do, right? $250,000. It's so these are averages again in like 2019. And the averages, it can be all over the place. So I have a friend who is a counseling psychologist. He has a master's. He works in Agora Hills. So he works with like a higher, more affluent area. He makes easily like 160, 180 a year on average. I asked him and he had no problems telling me. Right? I was like, how much do you make a year? Right. But he didn't care. But so these are kind of average numbers in California, but they all have a slightly different focus. But we tend to refer to them all together as like therapists, but a little bit different. School psychologists work in the schools, right? So in a school setting, looking at intelligence tests and aptitude tests, doing a little bit of therapy, placing people in the right classes, the right resources, working with students and teachers and parents together. Social workers do a lot within the institutions of psychology, right? So they're kind of coordinating services between different groups of people. So maybe they work with the parents and also the teachers and also the legal system, and they're kind of coordinating all those services together. They don't tend to do as much therapy, but it sometimes can be part of their job. And then you can be a clinical researcher, somebody who conducts research to predict and explain abnormal behavior. You can obviously teach psychology in like a college or a high school or even a middle school. There's so many different jobs, but these are some of the big ones that relate to what we're doing. And then forensic psychologists, which we'll get to in the last chapter, who work in the intersections of law and looking at insanity pleas and things along those lines. Any thoughts, comments, questions, anything at all here? Yeah. Yeah, I'll leave it up. I'll leave it up if you want to. I'm just kidding. I'll get out. I don't want to be in the big tent. Right. Anything else here for now? Anything else? So, yeah, sir.
About how like more like or not like psychology, like positive psychology, psychology play a role in this. Because I know when you get like your degrees,
yeah,
you say, oh, I'm gonna get a PhD as a clinical psychologist. So it's like, can you get it as a focus on positive psychology?
Yeah. Sure. So a lot of schools have like areas of focus, right? So like let's say you go to a university and you're signing up for a master's degree. You might sign up for experimental psychology, clinical psychology, cognitive psychology. Sometimes you pick like a specialty area. Other times you just get the degree, like the PhD, and then you can take a certain number of courses to specialize in like positive or experimental or cognitive or whatever it might be. So kind of a variety, but a lot of places have specialty areas if you want to like specialize in a certain thing. Yeah.
So for an MFP license, you have to get a master's like
3,000 hours, yeah, it's a lot of hours, but, and I think I shared with you, I did 1,500 hours, which is a lot, that's a lot of hours, right? And they also award you, if you go to therapy, they give you credit for that as well, they actually double count it, because they want you to go to therapy, so if you go to therapy each week for an hour, they count it as 2 hours, and that counts towards your 3,000 as well. Right, and oftentimes you get paid for those 3,000 hours, if you're lucky, if you can find a job that pays you. It's kind of like you're working your way toward the position one day, but it is a lot of hours. And then you take a test and then you're licensed.
As a training team, do you know which state gave the highest average salary? 'Cause
I don't.
California is known to be give the higher ones, but I feel like there could be other states. as
Somebody
well.
look it up, right? Look it up real
Oh,
quick.
it's
What,
like,
most, money per state. If you find it, let me know, right? But what state pays the most for therapists? So we know where to move to. Yeah. I have one thing to leave you with, and I don't have this in every chapter, but if there's like kind of an interesting book or movie or topic, like if you want to know more, this book is really interesting. I just finished reading it over, I think it was over the summer. The Myth of Normal was kind of an interesting book talking about like how do we know what's normal versus abnormal, something we talked a lot about in this chapter. So just put that up there if you're interested in kind of more on that topic. Otherwise, what we'll do in a moment is we'll move on to chapter 2. So any last like thoughts, questions, comments, anything else with chapter 1? Yeah. All of them, right? So with a master's and a PhD, you can do it. Not always with the MD, it's usually more like an internship, but you might have to do it along the way. Now, so typically you do a thesis where you write like a very big paper, you conduct an experiment or something along those lines, as part of each one of those degrees.
Does the number of publications you have increase, give you a higher salary? Like somebody who during their 5-7 years of clinical, not only have a thesis, but had their own personal studies, they did
Sure.
because they were curious. Does that increase your pay or just same pay?
It depends on where you work. So in a university setting, like, so not community college, but university, it's expected that you publish because it brings in money and like, kind of, attention to the school and the department. But if you're in a private practice, it probably wouldn't change anything other than maybe you could charge more, because you have more of a reputation. So not always, but some places do require it as part of your work.
And it is possible, right, to say like you do work, but then you realize like you're kind of over the psychology, like you're over the counseling kind of thing. If you want to start teaching,
Yeah.
is a PhD enough to get you to teach in college as opposed to masters?
Yeah, I mean, you could teach college with a master's. Yeah, I taught at Humboldt State and here with just a master's. But a lot of people who teach at like a university level do have a PhD. Not always, but it's more common. I think I'm the only full-timer in our department who only has a master's. Everyone else has a PhD. Not that bothers me. That's all right. I was done with school. I already owe so much money. I was like, I can do everything I want to do with a master's. Why would I keep going? But I do love school, so I've thought about it many times. But I have little ones now. Like, I don't have time for that. Like, I'd rather watch football and eat self-cake and stuff. Anything else here for now? Will we move on? Okay. So let's go to chapter 2. So as I said, we'll set the stage. There's 3 chapters of kind of getting up to the disorder. So we're getting closer. Chapter 2, we're going to look at all the different models of abnormality. And if you've taken other psych classes, you know that psychology is all about theories and models. There's a lot of overlap when it comes to this topic, but we're focusing specifically on abnormal psychology in our models here. So what we'll look at is how can we view abnormal behavior from each one of these perspectives? And then from each perspective, what are some of the big causes? What are some of the big treatments? And then you'll see them a lot as we go through this semester and talk about the individual disorders. For each disorder, when we get there, we'll talk about which models best explain it and best dictate like treatment. So when we're talking about models of abnormality, we're talking about sets of assumptions that help us to explain and interpret something. right? They spell out kind of basic assumptions. They give us guidelines for what we think causes something, what we think might lead to treatment. They often conflict with each other, right? So we're going to look at, for example, like the biological model, which is going to say that mental illnesses have physical causes to them. Freud's model would say it's all about the unconscious mind and early childhood. A behavioral model would say it's things that you've learned and conditioning. And in the end, it's probably some combination of all of them. Like if you ever want to sound brilliant and be right in psychology, just say it was probably a combination of factors that led to X. And you're right, right? It's always a combination of stuff. So we'll look at some of these different models separately, but know that they all kind of combine together typically to explain whatever it is we're studying. Does anyone else need this? Can I erase it? I always think in this class it'd be funny if I just kept erasing. Like at what point would that like cross over to abnormal? I should keep these things to myself, but I'm incapable of doing it. So. It's more entertaining. Oh, good. All right. Well, because I can't stop. So, that's good. I'm glad. All right. First one, the biological model. And what I'm going to do is I'm going to write like a couple of keywords for each one over there, just to help you keep track. So the biological. Sometimes called the medical model. From this perspective, mental illnesses have physical causes. So things like biology, like your genetics, for example, neurotransmitters. And we can also say like brain structure. And things that are up here. And so from this perspective, if people have a psychological disorder, it's because they have something physically going on that's causing them. And there are a lot of like physical causes that we can talk about. From this perspective, one of them might be anatomy. And so when we talk about depression, for example, we've learned in the last 10 years that there is a brain circuit for depression. A group of structures in the brain that work together to create the perfect storm to cause somebody to maybe be depressed. That would be a great example of like an anatomy issue that could lead to a mental illness. Brain chemistry is another huge one. Neurotransmitters are the culprit for a lot of mental illnesses. And we're going to talk about these all semester long, these little chemicals. Can anyone give me an example of a neurotransmitter? There's a bunch of them. Yeah. Serotonin, what's another one? Dopamine, anything else? Yeah. Norepinephrine? That's a tough one to say. Norepinephrine? Anyone know another one? Hormone. Similar idea.
You're right.
Yeah. Right? Hormone, the same with cortisol. Those are hormones, but they do also affect our body in a very physical way. Glutamine, GABA, acetylcholine, there's a bunch of them. Right, these neurotransmitters play a really big role in mental illness. I'm going to draw you something. I'm always hesitant to draw. I'm not an artist. Okay, here's a neuron. There's going to be another beautiful one back here. Oh, it's so pretty. It's so sad you can't see it. I picture it so nicely. Yeah, neuron, little dendrites. You get the idea. Right, cell body, neuron. I know it could be better, but that's okay. All right, so neurons communicate with each other through what's called electrochemical communication. The electrical piece is controlled by these little particles called ions, and they're inside and outside of a neuron. They can be negative or positive in their charge. And whenever there's any kind of message that needs to be sent, little gates open up. We're going to do this through a very high-tech process. Gates open up. And they flow in and out, changing the electrical composition of the neuron, causing it to fire. When that neuron fires, that signal goes all the way down to the end. And then at the end, these little terminal buttons are gonna release neurotransmitters that float across the synapse and connect with my next beautiful neuron that, again, you can't see and it's so pretty, right? So that's how these work. The chemical piece are the neurotransmitters. The electrical piece are the ions. And this process is going on constantly. So if people have too much of a certain neurotransmitter, or maybe not enough of a neurotransmitter, it can cause problems like depression, anxiety, schizophrenia, like the list goes on and on. So we'll talk about those all semester. There's a lot of neurotransmitters that play a role in mental illness. Genetics is another big one, right? You can inherit quite a few of these different mental illnesses. They can run in families. And sometimes viral infections, like during pregnancy in a prenatal like environment, if someone gets a certain infection, it can make them more vulnerable as well. Is that that's all. So lots of like potential biological contributors. If we think it's one of these, then we're going to approach it through a biological treatment. So that's kind of the idea with these models, is that if we think it's something biological that caused it, then we're going to treat it biologically. Lots and lots of medications. We just mentioned medications a few minutes ago, right? Medications can reduce the symptoms of depression, of anxiety, of whatever it might be, by altering the neurotransmitters that are present, right? And maybe out of balance. There's also some more like severe methods that we can use, different methods that we can use to help people who might have a like biological like issue causing mental illness. And some of them come in the form of things like brain stimulation methods. Or you mentioned One Flew Over the Cuckoo's Nest. I have a little clip to play of that here. On like the old standby of these is electroconvulsive therapy, or ECT. This is starting to really lose favor, and we're moving more towards something called TMS, which we'll talk more about when we get to the depression unit. But ECT was like the old standby, where we hook up electrodes to somebody's head and cause them to have a seizure as a way of like resetting and activating some of these brain circuits involved in depression. Now you have what's called a clonic seizure, which means you lose consciousness for like 2 to 3 seconds. And so we pass an electrical current through you, you lose consciousness. It's thought to activate brain regions, kind of reset and restart the brain in some way that we don't fully understand, and alleviate things like depression. Now, we experimented with this for a very long time before arriving at ECT. The first documented cases, and I won't ask you this, but just as a side note, back in the 16th century, we used to use different substances to cause people to have seizures to try and alleviate depression and things like that. In the early 1900s, 1937, and again, I won't ask you that, there was a patient who had schizophrenia who hadn't spoken a word in months. And they decided to try an electrical current on this individual to see if it would help. So they passed 55 amps through this guy for 2 seconds. He sat up and said, "What the are you trying to do to me?" First words he had spoken in months, so they considered it a great success. We've been refining it ever since. All right, so let me show you kind of what this looks like. It's a little brutal, right? So remember, this is a movie. It's not real. But it was something that was really harsh. Like, notice this guy, it is still something where we pass an electrical current and we hope that in some way it kind of kickstarts the brain circuits, that it alleviates depression, tends to have a lot of side effects. People hurt themselves, which is why he's strapped down. But we have moved, as I mentioned, to kind of calm, less invasive practices. And we'll talk more about it later, but TMS is a really popular new one, and it's finally starting to become accessible. For a lot of years, it was like the better place of doing, like the better method, but it was too expensive. And so now what they do with this one is they place a little magnetic coil just right above your head, and they send targeted pulses to a very small area of the brain called Brodmann area 25. We don't need to know that for now. But they place on this coil, and it just sends like a bunch of little pulses rapidly in a short period of time, causing depression to be lessened. So we've gotten better. And in very, very rare cases, we might even do a surgery, but that would only be if there was something we could potentially repair, where there was some kind of brain damage that we could do something about. So these are some of the really common like biological treatments with medication by far. being the most common or popular one. Yeah. Mm-hmm. Yeah, so that would be a great example, right? So somebody's struggling with like seizures, and we go in and sever the corpus callosum, that band of fibers that connects the left and right brain. That would be a psychosurgery for sure. It could be going in and like, you know, if there's damage to an area of the brain where there's like a blood clot or something that can be like cleaned up in some way, it might be that. But it's pretty uncommon that a surgery could fix something like that, but there are some that are done in like rare cases where it's applicable. But yeah, that would be a great example. Like the famous case of the guy Joe who had his corpus callosum severed, if you've seen that in like an intro psych class. Anything else before we go on to the next model? Any other thoughts, questions, comments? Okay, next one. Freud, good old Freud. You know it's Freud because he's holding a cigar. Always holding a cigar. And as a side note, it's what killed him, right? Most famous psychologist of all time was so addicted to cigars that he couldn't cut his habit, died of cancer of the mouth, right? So most famous therapist of all time couldn't curb his own addiction, right? As a side note. But Freud and the psychodynamic perspective, psychodynamic or psychoanalytic, from this perspective, okay, so we've got Freud, and we're looking at the unconscious mind. The things that are below your awareness. We're looking at like early childhood. And we can say sexual and aggressive behavior. Super controversial theory, but this was the theory that started it all. Right? Freud was the first one to really propose a lot of these ideas that everybody who came after him built on. So Sigmund Freud, probably the most famous of all psychologists, right, is the person most people know about. Again, holding his cigar. What do you think of when you think of Freud? What are some things that like come to mind when you hear the name Freud? Anyone have like things that pop up?
All sons, like, are attracted to their mothers.
Yeah.
Daughters are attracted to their fathers.
Yeah, so that Oedipal and Electra complex for sure. What else? Anyone else? Yeah. Yeah.
Insane titles.
Mhm.
Childhood.
Right, that you have these stages where like that libido is focused on different parts of your body and you can get orally or anally fixated, which just sounds so awkward to say about like a 3-year-old, right? What else? Anything else with Freud? Yeah.
I think of the concept that psychology is a relatively new science,
Mhm.
and that because it's so new, like, look at engineering, like you see the history of engineering, there are mistakes that have been made, but so long ago, so us like, oh, it's obvious. Here, these mistakes were made like only 100 to 100 years ago. So it's the concept of you make a mistake in science, you fix it, you test it, you have a theory, you test it, and then you realize you have to find something new, which is one of the reasons people did Freud, because
Yeah.
he wasn't right about 90% of things that he said. All of his theories were very like not backed up, very like
They're not
case-based.
testable is the hard
Not
part.
testable,
Right.
they were case-based, also people don't love like seeing one case you apply to general, which is not fair, it's not testable, it's not valid.
Sure.
But I also feel like he's the beginning of psychology, of
Yeah.
the beginning it would happen, so.
Got to start somewhere,
Yeah.
right? But yeah, a lot of
It's
issues.
crazy. It's kinda crazy.
Right, and a lot of issues. Yeah, yeah.
I was thinking about how, like, the entire, like, psychology community is, like, based on proving them wrong.
Yeah, right. Like everyone wanted to prove him wrong,
Yeah.
right? Yeah.
Because they were affected them, they became their fathers, and they were to sleep with a woman like their mother.
Right. Yeah.
Which is apparently why all men date someone like their mother.
Right. From Freud's perspective, for sure. Right. Right. Very like heteronormative too, right? It's assuming that you have a mother and a father and you know, that you're in love with one or the other. Yeah, really like controversial ideas. Did you have your hand up too? Yes. Yeah. Yeah. For sure, Freudian slips, he said, are like the ways that the unconscious mind comes out. right? That the unconscious mind could reveal itself in little slips of the tongue. I had a biology professor in community college, and he was so slimy. And like, he was just like a sleazy, slimy guy. Like, I'll just say it, right? And every time he would always say orgasm instead of organism. And like, he would do it. He thought it was funny. He'd be like, this orgasm, sorry. Like, he had no like apology whatsoever. But that would be like a Freudian slip. You say the wrong name, right? You forget about something, right? Freud would say that that is very purposeful, right? From perspective. Yeah.
We also dealt with like childhood trauma.
Yeah. Yeah. Everything goes back to childhood and
right.
mom. It's always mom, right? From this perspective. It's always the mom. If you didn't have a mom, it's the mom, right? Like it's the mom. It's always. Yes, so if you didn't have a mom, you found a different mother figure, or you obsessed about a mother figure that you didn't have, right? Everything back to the mom. And what's interesting about the people in psychology, the famous people, is their theories are shaped by their lives, right? And their theories are actually really revealing about their personal lives. He had mommy issues. He had issues as a child, right? And that's where a lot of his ideas came from, just as an interesting side note. But he was a big believer in what he called the unconscious mind. Right, so if you think of consciousness, we often use like the iceberg analogy. So here's my iceberg. Here's the water line. I have to. Here's the Titanic. Right. We need Jack at the front. Sorry. Oh, behind him. Oh my gosh, my kids this week. I don't know why that reminded me. We were watching a TikTok and it was like the song, you know, the iconic Titanic song. My 12-year-old was all like, I would have shoved her off the boat. I'm like, oh my God, what's wrong with you? She's like, why didn't Jack just push her? Like, you're the worst. Okay, there. Anyway, I had a point with this iceberg. So what you can see, what's above the water is what's conscious. What you are currently aware of right now, right? What you're doing, what you're thinking about, that's your conscious mind. What's just below the water, we call your subconscious or your pre-conscious. Like you probably weren't thinking about what you had for breakfast until I mentioned it, right? And then it might be on your mind. Or the feeling of your shoes or your feet in your shoes until I mention it, right? So stuff that can be very easily brought up. And then down here would be the unconscious. And this was like his gold mine, right? He believed in the unconscious mind, the stuff that's buried deep down that you can't easily bring up, that it would shape everything. And that you could access this through dreams. Dreams were the royal road to the unconscious mind, through Freudian slips, through free association and therapy, which we'll talk more about next time. But he believed quite a bit in the role of the unconscious, along with things that happened when you were very little, right? Childhood was a big thing for him. And then sexual and aggressive instincts, which he called like the libido, and so on, were also big parts of his theory. So I think what I'll do, I'll stop here so we don't have to like race through it. But what we'll do next time is we'll pick up here. We'll keep going with the rest of chapter 2. If you didn't sign in or if your name wasn't on here, make sure you come check this. Otherwise, have a wonderful rest of the day. I'll see you all on Wednesday. What was that?
So did you know about lucid dreaming?
I'm not sure that he wrote a ton about it, like a little bit.
If it's all connected